When a patient is being discharged from the hospital, what is the role of a medical assistant in transitional care management, or TCM? So remember that we want to focus here on the medical assistant's responsibilities, because when you quickly glance through some of these choices, and we'll go into them in greater detail, you might see words here that involve like consent and education and different aspects that might be better options for other healthcare roles on your team than from the medical assistant. So let's take a look at the choices and figure this one out. So option A says obtain written consent. Obtain written consent from the patient for all medications prescribed at discharge. And anything involving education toward consent, obtaining the consent, would be a provider role. So that might be your doctor, your nurse practitioner, your physician assistant. The medical assistant might be, in some instances, checking to make sure there is a consent present, but they wouldn't be the person who is obtaining the consent, because there's education involved in that, and that would be a requirement of the provider who is making the prescription. So we can eliminate option A. Option B says document the discharge plan in the patient's medical record. And documenting a plan related to discharge, that would be something that also is more the provider's responsibility with that type of charting. So we can eliminate option B. Option C says educate the patient. So we see education, that usually is like a nursing type responsibility. Educate the patient about potential side effects for their new medications. And that would be something that an RN, a registered nurse, or an LPN, licensed practical nurse, or the provider themselves would be doing, educating the patient about side effects of medications. That wouldn't be the medical assistant's scope of practice. So eliminate option C here. And now looking at option D, coordinating follow-up appointments. So coordinate follow-up appointments with specialists and primary care physicians. And that is something that can be within the scope of practice of a medical assistant, because you're just coordinating, you're helping to make plans for the patient. It doesn't involve any sort of education, any sort of documenting a plan, any sort of obtaining consent, which would be more in the provider's scope of practice. However, coordinating care for the patient, and also the question is talking about transitional care here, and coordinating follow-up is involved in transitional care. Overall, this is just a good answer choice for this question within the scope of the medical assistant. So we will go with option D in this scenario.